and welcome back to Three's Company. If you're an avid watcher of our channel, you'll notice that this isn't our regular content, but this is something I do believe is important and an experience a lot of children go through. This is my take on my experience that my 5 and 8-year-old had to go through. I hope this video provides clarity and answer any questions or concerns that you may have if you and your little one is going through with this procedure. Now my family had to wake up at 4:30 in the morning because we had to be at the hospital by 6:30. They were advised not to have no food after 10:30 the night prior until 4:30 a.m. that morning. After that, they could only have apple juice, Pedialyte, Gatorade, or water. My son Nehemiah was set to have his appointment first at 8:30 and my daughter after at 10. While we waited, there were a lot of nurses checking in on us and making sure everything was clear for surgery. The kids were kind of excited because they really didn't know what to expect. They were just really happy to have their passport bugs and excited to get their next sticker. The doctors and nurses are aware that surgery of any kind can be a tedious process and different for the kids. Knowing that they have to check on them multiple times can be a lot. The way the kids earned stamps or stickers on their passport was every time a nurse came in to check on them, they would get a sticker, which made them excited every time a nurse had to come in the room, which happened upwards to 5 or 6 times. Once we were finished with the first round of checkups, we were sent to this holding room. I'm going to let you listen in to the first set of instructions we were given.
He's going to go first. He starts first, and then after he gets back, we'll bring another diaper first. And then the pajamas that we gave them, they tie in the back. Everything comes off, including underwear. And then you guys can help them wash their hands from fingertips all the way down to their elbow. You guys can use this sink. You guys will also have a restroom over here around the corner to the right. And then remote in the back for TV. And then if you guys need anything, just let me know, okay?
Okay.
Everyone should be in shortly.
Thank you so much.
Alright, so after those instructions, we did everything that we was told. We got the kids together, got them in their new pajamas, and as you can see, they loved them. After that, we had a doctor come and explain what to expect during and after the surgery.
Correct. No asthma, heart issues, seizures.
No.
Any family problems with anesthesia that you know of?
Not that I know of.
Okay. And then any teeth, loose or chipped, missing in any of them?
Any what?
Missing teeth, loose teeth, braces, retainers?
No.
Might have a loose tooth.
Anything that's loose, wiggly,
Very.
missing? Nope, perfect. Okay. So what we'll do is for both of them, fall asleep with a mask. Once they're asleep, we'll get an IV in, get some sleep here, place a little breathing device in for the surgery, take it out after everything's over. Probably have a sore throat from that breathing device for the next day or two. You can do typical sore throat things, but that'll get better by itself.
Okay.
Give some anti-nausea medicine to both of them to minimize the risk of nausea and vomiting after anesthesia. They'll just be sleepy for the rest of the day until they get a nap in, just until I get more of the medicine out of the system. For pain control, usually Tylenol and like Motrin is pretty good. And then what we can do as well when they're under asleep, you can inject some numbing medicine with the ultrasound right next to the hernias themselves.
Okay.
And that provides good pain relief for about 8 hours, so that they won't feel anything, just right around their belly button. And then
Okay.
after that, they can just transition to Tylenol if they're bothersome.
Okay.
The biggest risk with that are bleeding and infection. We do everything
Okay.
sterilely.
That is something I would do. I would put some in
Nope.
their belly. Oh, that's what you guys
So
do.
we're
Oh,
gonna-
okay.
yeah.
Okay.
They don't have any increased bleeding risk. We do everything sterilely to minimize the risk of infection as well.
Okay.
There aren't any nerves there. We're just kind of injecting where the nerves are supposed to be, so unlikely to cause any permanent nerve damage or anything like that. Very rare, probably like 1 in a million chance of that actually
Is there
happening.
any,
Okay.
is there any downside to the injection of the,
What was that?
is there any downside to putting it in there? Is there any side effects from the?
Not really. It just helps them a little bit better with the pain control afterwards, so they need less narcotics, or sometimes we can get away without giving them any narcotics. So
Okay.
it's kind of nice for them, so they get less side effects from the narcotics itself.
Do they get to pick their flavors of gas?
Yes, Child Life will come by, and then she'll show you the masks, and then they can flavor it with the
Yay.
chapsticks, and that kind of helps them fall asleep. She seems very relaxed and chill.
Yeah.
He seems a little hesitant. Do you think he needs relaxing medicine to go back, or do you think he'll be okay?
Oh,
yeah.
no, he's very chill.
I can't tell, because he's so chill, but he also looks anxious, but maybe tired.
He is. I would still. Why not?
Well,
Give him some relaxing medicine.
I think he's fine. Talking about before he takes the gas.
Yeah.
I think he'll be fine.
Okay.
He's pretty
Okay.
Sounds good. Do you have any questions?
I have no questions.
Good. We'll take great care of them. We'll see you guys soon. Hopefully we
Thank
can go a little bit early, but we'll see.
Thank you so much.
You have bad one. I promise you did. You had a good Northland.
Now, after that conversation, the doctor left and the nurses came in and brought them some warm, cozy, hot blankets, which they loved. And again, a nurse came in to confirm all the information and make sure everything was right and everything was a go for surgery. At this point, the kids were used to it.
And is everything spelled correctly on here? Did you guys check out?
Yes, they had us check them. Y'all got another sticker for your passport book?
Nehemiah is scheduled around 8:15.
We played music and had fun, and we just wanted to keep everything lighthearted, noting that the kids had been up since 4:30 that morning, and now it's going on 8 o'clock.
Let me see you dance, Nemo. Go, Nemo.
Then they had a person from this establishment called Child Life come in. Her job was to explain to the children the surgery and what to expect in terms they can understand.
Ready to go soon, so I brought photos of all the rooms they'll be in and the mask they'll go to sleep with to show them.
Okay.
So you guys did your height and weight and blood pressure when you got here, right? And then this is like where you are now. This is the room with the blue wall. You changed into your pajamas. This is the room where lots of doctors and nurses are going to come in and meet you. Okay. What? Sound good? You've probably, I think you've seen all your doctors already. There's been a lot of people in here, huh?
Yes, it has.
Yeah. So pretty soon, Nehemiah is going to go back to the next room with a nurse. And Nevaeh, you'll just stay right here with your parents, and then when they're ready for you, they'll come and get you, and you'll go back to the next room. And when you guys go back there, that'll be the part you'll say see you later to your parents, and you're just going to go back with the nurse, and you're going to see all your friendly doctors back there. The next room you guys will go to, it's got a lot of machines and equipment in it. They're not going to use all this stuff for your surgery today. A lot of that stuff just kind of stays in this room. Okay. When you get in there, you have one big job, and that's to lay down on the bed, and you'll breathe through a mask. So this is my mask. It goes on my nose and my mouth like this. Makes my voice sound silly, but it's not ouchy or pokey. It's pretty squishy. And then that's how you're going to get the sleep medicine with the doctor. So if you guys want to pull your mask down, this one will definitely fit you. Let's see. Pull your mask down, Nehemiah. Let me get you that size.
Like a balloon.
I know. Or like it smells like a beach ball, I think, or a shower curtain.
They look so cool, like little bubbles on your face.
I know. How does it smell?
Ooh.
We can make it smell better. I've got mango, cookie, strawberry, or kiwi.
What flavor you want?
Chocolate, the cookie?
That one.
You want kiwi?
Yeah.
Okay. Let me get your kiwi one ready. This one's a good one. It's like a fruity one. And the oatmeal cookie is a good one too. It's kind of like a chocolate. All right. So now smell it and see how that is. Is it good?
Yes.
Do you like it better? And you can keep that chapstick. Here, I'll give it. Should I give it to your dad or? And then here's the oatmeal cookie. Give that one a smell. Is it good? Okay, cool. I will put this in your mask for you. So when you guys go back there, that's going to be your big job to do that with the doctor. How old are you, Nevaeh?
8.
8. That's what I was going to guess.
It smells like oatmeal cookies.
And that's for you. So when you guys do that with the doctor, it will help you to be asleep while they fix your hernia. At home in the nighttime when you guys sleep, if you hear a loud noise, what would happen? What would happen if you were asleep at home and you heard like a dog bark? Would it wake you up?
I have dogs and
Yeah.
they don't bark. They just get knocked out. Or
That's good.
Do
I know.
you knock them out or they just sleep?
they sleep and then
Nemo knock 'em out.
And then when they're not asleep yet, they bang on the cage.
Well, if you were asleep at home and you heard like a firework or a thunder, you guys might wake up, right? But this medicine you're going to get through the mask. It's a much deeper sleep. So you won't feel ouches. You won't wake up until they're all done with your surgery. And then when they're all done, you won't hear noises either. When they're all done, you'll wake up in the wake up room and we'll bring one of your parents in there to be with you. And then The best part about waking up is we'll give you popsicles and slushies for breakfast. Okay. You have a little.
It's like at home.
I know. You have a little Band-Aid in your hand. That's an IV, so we can give your body water and medicine. I like to show it to you because some kids think it's going to be pokey, but it's actually just a little straw. You want to feel it? Here.
Feel it. See?
See, it's like not sharp. It's like a bendy little straw. Do you want to feel it?
It does feel like a bend.
I
Why
know.
don't they have those from both?
So when you wake up, you're not going to have anything sharp in there. It's just a little straw, and we'll take it out before they go home. And then we'll watch you guys for a little while, and then it'll be time to go home. It might be like a good day for movies on the couch or something like that at home. You guys might be kind of sleepy still after this.
I like to play with my puppy.
That sounds great. How many dogs do you guys have? Two. What are their names?
Violet, blue.
Violet and Blue. I like that.
They're twins.
Is she pushing? Why are you talking to the mask?
You can take it off. You can take it off. Yeah, you could just hold it.
Because he's talking with it on, we could smell it.
And it makes your voice sound silly, doesn't it? I like that part. Do you guys think you can do all that stuff that I showed you in the pictures?
Yes.
Yes,
I think you
ma'am.
guys got this. Yeah. I think they're ready. You don't have to keep the mask on, but if you guys like to play with it, you can, okay?
Thank you so much.
Yeah. You're welcome. Do you guys have questions?
No.
Sweet kids. Yeah. You guys take care. That's for you to take home. Yep. You keep it.
After that pep talk, the kids were more than ready for their surgery. And when I tell you they were obsessed with these little face masks, they loved them. They kept them on their face the whole time. And of course, after the surgery, we took them home and they wore them for 2 days after that. So make sure to save these memorabilia for your children. Nemo's got the head up. You kiss? I'll see you later, alligator. So at 8:25, it was Nemo's turn. He was more than ready to go. He didn't seem nervous or hesitant at all.
Give me a thumbs up.
While we waited, they brought Nevaeh in some Legos, and that was enough to keep her busy. They actually brought her quite a few toys, and she loved it. She wasn't a bit worried or nervous. So around 9:25, they came and got her. So the procedure took around 45 minutes, not including the prep time or the time it takes to wake them up from sedation.
Sing your song, baby, 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 oh. Bye, babe. See you in 2 seconds.
Soon as Nevaeh left, it was time to go check on Nemo, and he seemed to be doing okay. When we got there, his wake-up nurse was feeding him green slushy. I asked him how he was doing, and he really didn't answer me that much. Even though he was calm, when the nurse checked his vitals, it showed that he was in a lot of pain. The nurse did offer us fentanyl, which me and their dad wasn't too sure about. The nurse assured us that it wasn't the same fentanyl that they sell on the street, but I beg to differ. I definitely would advise that you ask a nurse for any and all options when it comes to administering medicine for pain. For your little angel.
Sister, okay?
And for your sister, we're gonna go home and watch some movies, okay?
Grab my hand.
We needed to change Nehemiah out of his hospital clothes, so we attempted to lift him up. This is how it went.
Grab behind you, okay?
Good. Oh, go slow. Oh,
That's what got you. You okay?
oh.
It's okay. It's okay. Just later, okay?
Okay.
You okay?
After that, we decided to put both our brain cells together and just unsnap the shirt off, which is what hospital gowns are made for. We managed to get him back in his regular clothes and sit him up. As you can see, he was happy. They gave him all the green slushies he ever wanted and put on his favorite movie. I would say he was doing good. After that, it was time to go check on Nevaeh. Her vitals showed that she was in a little bit of pain, but she pretty much was just sleeping through it. I did those like the day before yesterday. Yeah, I'm practicing. I'm not good, but so after everything was said and done, we left the hospital around 12:10. So from 4:30 a.m. to 12:10 in the afternoon. You do the math. But everything went well. The kids were happy. I couldn't ask for more. All right, guys. Hello, everybody out there on
We have
YouTube.
2 new additions.
Can I talk, please? Hello, guys, everybody out there in YouTube world. We just wanted to update you guys for all the kids out there that may be going to get a umbilical hernia surgery and they're wondering how it is. I have 2 kids right here. I have Nehemiah, who is how old? How old are you, Nehemiah?
5.
And Nevaeh, how old are you? 8. And they just got their umbilical hernia surgery. So they're here to pretty much tell you about their journey and how it went. So were you guys nervous when you guys went?
Hold on. We have 2 new additions who are outside on our porch.
But they don't know what you're talking about.
Let's show them.
No, well, this particular video is about umbilical hernias. Come on, Nemo, so you can talk about your experience. All right. So, were you scared? No.
I didn't feel nothing.
You didn't feel anything. What about when you were done?
Fine.
You felt fine. And just a little update. We live in an apartment and we're on the 3rd floor. And both of them were able, right after their surgeries, were able to walk up the stairs, no problem. You want to show them your incision? There's like a little bit of blood on it, so I think that's a little bit normal. You want to stand up and show them your incision?
Okay.
Boom. Nemo, you want to show yours? Nemo, you're not gonna be in the video. Come show them your belly button.
I'm gonna kick you in the butt.
Come on, come show them your belly button. Everybody wants to see your belly button.
Every time I laugh, it hurts.
It hurts when you laugh. Oh, okay, so I guess I just have to take it easy. But if you guys are worried about if it's gonna be painful or scary, you don't have to worry about any of that. We went to Children's Colorado Children's Hospital, and the staff there was amazing. Here, you want to show them your belly button, Nemo? Come show them your belly button. Come show them your belly button. Ooh. And Nemo as well was able to walk up 3 flights of steps on his own. But I particularly made this video because when I was looking for a video to show my children about this procedure, I didn't see none. So hopefully this video will be helpful to a lot of you guys who are going to be dealing with the same thing, and you can show this to your little ones to let them know they don't have anything to worry about. They don't have to be scared. It is a painless procedure. There's a little discomfort when you're finished, but nothing that a little bit of Tylenol or Motrin can't handle. So whoever's getting this procedure, guys, you're gonna be fine, and it's gonna be amazing, and you should be excited because it is a wonderful, wonderful, wonderful experience. As you can see, we had to get up at 4:30 in the morning.
I was tired.
You was tired? What? This fly? Jeez, we let a fly in.
I want to cut it.
What?
I want to cut the fly and throw it out.
Okay. We had to get up at 4:30 because we had to be at the hospital at 6:30. And they started, Nehemiah went first. They started their procedures at 8. They took turns. You guys will see it throughout the video. But yeah, that's it. So if you're about to get if you're gonna get the umbilical hernia surgery, there's nothing to worry about. It's easy peasy, lemon chicken squeezy.
Stay tuned for a video right now in this one about our new puppies, which I can show you right now real quick.
She wants to do a video about puppies. Oh, I hate flies. Jeez. Hopefully this is helpful to you and your little ones. Thank you so much. Peace. Babe, no, you don't need that anymore. Oh my gosh, it's silly. Now this video was filmed around 1 or 2 days later. I just thought it would be important to show you how mobile they were. Now, even though I could tell physically that the kids were doing well, they're very reluctant on telling me out their mouths that they feel well because they assumed if they did, they would stop getting popsicles.
Because my tummy hurts when I walk.
Get your dirty foot out my camera. I'm gonna kick your butt. Nemo.
Then give me a popsicle.
You better not kick my phone at my hand again. You sure is playing a lot for somebody who's hurt so bad. Stop.
No.
Let me see it.
No.
Let me see it. Stay still. Let me see it. Ooh. Looks good. Looks good. Digga, 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 digga. Digga, digga, digga. You okay? Does it feel good?
No.
No.
Blood is on it.
Yes, blood is on it.
This is still a few days later. I took him out a little bit just so they could get some sun. I wasn't expecting him to run around like this, but he did. No, he was not supposed to be in the water. My daughter, on the other hand, she was still playing it safe. I had to keep reminding her to walk up straight. I think she assumed just because of the surgery she had to walk bent over. But once I reminded her to walk up straight, she was fine. I hope this video helped. Thanks for watching. Bye.